What are the characteristics of ideal health indicators? They should be valid, reliable, sensitive, specific, feasible, and relevant. Which one of the following statements regarding predictive value of a positive test is true? It tells the probability that a patient with positive test has the disease in the question. The yield of a screening test cannot be increased by which of the following, including entire population. Which of the following statements regarding growth chart is not true? It is used as a tool for action against the Anganwadi worker. Flattening of growth curve in the growth chart signifies child is showing signs of growth failure. A well of contaminated water resulted in an outbreak of diarrhea in a community. Which type of epidemic will this exposure present with? Common source continuous exposure. Which one of the following experiments trials is not a part of non-randomized trial? Risk factor trial. What is the relative risk of developing tuberculosis among tobacco users as per the information given below? Answer is 2.67. What is the attributable risk of tobacco for developing tuberculosis as per the information given below? 62.5%. What is the sensitivity of EEG for detecting brain tumors as per the information given below? 90%. Which sign is most important in deciding severe pneumonia in a child? Chest in drawing. Varicella zoster immunoglobulin (VZIG) is not recommended for which of the exposed susceptible individuals? Healthy sibling. Carriers of a virulent organism are called pseudocarriers. A cohort study was conducted among 20 men aged 20-30 years of Rampur village. Out of 200, 120 men were tobacco users. Rest 80 didn't take any form of tobacco. At the end of 1 year, 40 men among tobacco users and 10 men among non-tobacco users developed tuberculosis. The incidence of tuberculosis among tobacco users is 33.3 per 100 men per year. The data regarding two exposures A and B associated with the disease X in a community is given below. Which one of the following assertion and reasons given is correct? Preference to control exposure A because it has a higher population attributable risk. Which of the following types of study designs will be most appropriate to find out association between mobile phone radiation exposure and cancer? Case control. The villages A and B have the following age compositions. Which of the following is the best indicator for comparing the death rates of these two villages? Age standardized death rate. Which of the following are suggested by rising incidence rates of any disease? Need for a new disease control program, improvement in reporting practices, change in the etiology of the disease. What constitutes the denominator in total dependency ratio? Population 15 to 64 years of age. A pregnant woman in second trimester of pregnancy from northeastern state has been diagnosed with uncomplicated Plasmodium falciparum. She should be treated with artemether and lumefantrine. By which one of the following studies can be relative risk best calculated? Cohort study. Orthotolidine OT test is done for determining residual free chlorine quantitatively and qualitatively. What is the color of the solution after adding OT, which indicates presence of free chlorine? Yellow. Consider the following in respect to Navjat Shishu Suraksha Karyakram (NSSK). It is a program aimed to train health professionals in basic newborn care and resuscitation. It addresses care at birth issues, that is prevention of hypothermia, prevention of infection, early initiation of breastfeeding and basic newborn resuscitation. The objective is to have a trained health person in basic newborn care and resuscitation unit at every delivery point. The most important indicator for assessment of impact in salt iodization program is testing median urinary iodine excretion. Caisson's disease is usually seen in which groups of workers? Construction workers under sea level. Toxic effects like abdominal colic, obstinate constipation, loss of appetite, anemia, stippling of red cells and blue line on gums are due to exposure to lead. Which one of the following conditions can be screened during neonatal screening by biochemical tests? Congenital hypothyroidism. Which of the following is not a mass approach in health communication? Role play. Which of the following are non-modifiable risk factors of hypertension? Age, sex, genetic factors. What is the correct daily dose of iron and folic acid to be prescribed to a child aged 12 years? 100 mg elemental iron, 500 microgram folic acid.